Hello and welcome. I'm so glad you're here. My name's Karen Tripp, and I'm here today to be the presenter for the topic cancer screenings and COVID-19. You can see that we've kind of added on there the subtitle of in 2021, cancer stories will begin. First, my cancer screening was postponed. Stop for a minute and think about perhaps your own cancer story or the other cancer stories of people that you know, especially the ones who were diagnosed through a cancer screening. Perhaps they had absolutely no symptoms at all, nothing completely apparent to be able to warrant a trip to the doctor. And yet it was time for their mammogram, it was time for their PSA, it was time for their colonoscopy or their cervix exam. And so because of those things, they ended up being diagnosed. That's what our topic is going to be about today. Is about looking at the impact of cancer screenings during this age of COVID-19 pandemic. So that's a pic. There we go. There's Karen Tripp. Yes, I'm a licensed marriage and family therapist. I'm also the founder and executive director of a nonprofit ministry called Cancer Companions. And the first book that I ended up publishing was a book called God is Bigger Than Your Cancer. And so those are the things that have kind of brought me here, being in the cancer community for many, many years. And so I'm happy to be able to share the things that I have noticed of pieces of the puzzle coming together of where the cancer community is headed at the end of this COVID-19 pandemic, or at least at the end of the quarantine period. So, first of all, we kind of address the issue of cancer screenings. The American Cancer Society, as well as other health agencies, recommended that routine cancer screenings be postponed due to COVID-19. Now, at the time of me recording this, being mid-May, some states are already opening up the opportunity for people to be able to do that. But there definitely was time periods in every state, I would think, of hospitals and cancer centers asking people that were just having their routine cancer screenings not to come in due to the COVID-19 concerns, which you can kind of understand, can't you? So what screenings are we talking about? Well, a handful of them would be the colonoscopy, mammography, PAP and HPV test, PSA test, and of course the CA-125 test. So what's the big deal about screening? Well, the big deal about screening is early diagnosis, right? Those are the two things that become connected. Finding and treating cancer at an early stage can save lives. I've always kind of personally had the thought that if I wanted to have a cancer, and I don't, if you got to pick what kind you want, though, the kind to pick would be an early diagnosis. And so that's the kind of cancer that is definitely makes the biggest impact on the treatments and outcomes. Let me read what the rest of this says here. This is from the Cancer Research UK.org. Finding and treating cancer at an early stage can save lives. Cancer that's diagnosed at an early stage when it isn't too large and hasn't spread is more likely to be treated successfully. You want them to find it early, guys. If cancer spreads, effective treatment becomes more difficult, and generally a person's chances of surviving are much lower. So yeah, we're definitely looking at having early detection, which of course means early screenings. So due to COVID-19, how many cancer screenings were actually postponed? Well, here's a few factors to consider. The first is that each medical center determined when to stop routine cancer centers screenings themselves. And through state guidelines, each will end up determining when to resume. So this is going to impact you a lot depending upon where you live and where you end up going to get your screening. Typical pre-COVID-19 frequency of 2 types of screening. So these are some numbers of what was common before COVID-19. If we look back a few years and we kind of say, well, how often and how many people were actually getting screenings, we find out that 65.3% of US women over 40 had mammograms. from 2013 to 2015. 65.3%, that's a lot. 67.6% of US men and women over 50 had colorectal screenings in just 2014. And so if we take those numbers and you use the gauge in each of those studies for what they use to determine the population for the US at the time, you come to find number 3, which is that hundreds of thousands of screenings are postponed each month for just these 2 types of screenings. That's a lot. It may not be a lot in the exact spot where you are. It may not be a huge impact on each individual, but there's no question that having cancer screenings postponed has created a backlog of screenings that are going to need to take place. So what is the impact of this backlog? Well, as cancer screenings resume, a wave of newly diagnosed cancer patients will appear, right? Does that make sense? That let's say that you go every March or you go every April to be able to get a specific screening done. Or maybe this is just the 3rd year or the 4th year or the 5th year that you're supposed to have gone, and it was scheduled and you ended up having to cancel it, or they canceled it due to the issue of postponing cancer screenings, right? And so all of those people are now also looking for their appointments to be able to start to take place as soon as the cancer centers and the hospitals start to open up the opportunity for screenings again. Second conclusion is, due to the postponement of screening, a larger percentage of these cancer patients will not have the benefit of early detection, right? And so if you were scheduled to be able to get a screening in March or April, and the next opportunity that you end up having to have your screening done becomes July or August, that ends up adding to the inability to have that early detection that could have happened in March or April. Doesn't mean that July or August couldn't still end up being early and couldn't end up still having the same impact for certain individuals. But overall, if we're talking about hundreds of thousands of people, you can see the trend would end up being there. The result of this is that we can anticipate there being more patients with higher stage cancers coming by the end of 2020 because of the lack of opportunity that everyone will have had to have the opportunity of early detection. So let's think about this some more. What should each of us do? If you're having symptoms, call your doctor. This does not have to do with people that are having symptoms that could end up being cancer. So if you're having some kind of symptoms, you go immediately to give your doctor a call and find out whether or not you should be coming in to be looked at and to have a test and to have a screening done. Number 2, if you have missed your regular schedule screening, reschedule as soon as you're able to. Try to stay in touch with what's going on in your local area and with the hospital or medical center where you end up having your screenings done. If you're unsure whether you are in need of a cancer screening, contact a doctor. That makes sense, doesn't it? So let's make sure that we are taking care of ourselves and getting the word out to our loved ones and friends and coworkers to do the same. Let's think about the picture a little bit bigger. So if there's going to be an increase of cancer patients coming by the end of the year, that could end up impacting the social service agencies, the nonprofits, and the churches. Of course, it's going to end up impacting the cancer centers as well, but I'm not in a position, being a therapeutic background, for me to be making judgments and recommendations around issues having to do with cancer centers functioning. So I've thought this would be a good opportunity for us to focus specifically on social service agencies, nonprofits, and churches. So the first suggestion I have is to notify staff, your boards, your clients, your parishioners, and contributors of the upcoming need for the increase of services for these cancer patients. We have to be smart of knowing that they're coming rather than trying to be able to continue to serve the same way as always. COVID is changing lots of things in our world, and this increase of needs medically, not just in the cancer world but others, is definitely going to be evident by the end of the year. So the more people and the sooner that you tell people that are making decisions about how to run your agency, nonprofit, or church, that's good. The second thing is to clearly identify your agency or church's role for cancer patients and caregivers from all the different stages, from diagnosis, from treatment, from post-treatment, and of course from hospice care. What is the role that your agency ends up having for this? Get some clarity about what piece of the puzzle of you being able to support cancer families and patients and what that ends up looking like. Number 3 would be consider increasing the use of trained volunteers to provide consistent contact with cancer patients and caregivers. At Cancer Companions, we have been so impressed with the quality of compassion and companionship that can end up coming from trained volunteers. Now, the training, I think, is very important, and we have a pretty progressive online training program that our volunteers end up going through. But taking the time, even as you are looking for more help, to make sure that people are trained to be able to provide the support services that you're looking for, I think is a very important piece of the puzzle too. Number 4, explore the use of virtual meetings with cancer patients to decrease potential for compromised immune systems. I really do believe that this is going to be one of the good outcomes that's going to come from this pandemic, is that I don't see us going backwards technology-wise, do we? I think we only move forward. And so there are now so many more people that are comfortable with using their phones and using their laptops to be able to communicate and interact with people, that I think we need to continue to use those devices in whatever way we can to be able to make sure that we're not going to get in the way of immune issues that can end up coming up by visiting in person. Number 5, build partnerships among agencies and churches providing a variety of services. Every location, every social service agency and nonprofit and church can't do it all for every cancer patient. We need to be able to develop better and better partnerships and teamwork among us to be able to know what's the piece of the part that you end up doing. Some places may end up being the place where people will end up getting insured by the case when they're financially not able to purchase that themselves, or perhaps it's a free wig, whereas other places may be more engaged in offering emotional support or spiritual support. And so knowing what the piece of the puzzle is that your agency engages with folks that are coping with cancer and looking for what other folks are doing so that you can end up developing referral patterns with one another is an excellent idea. No agency, church, or nonprofit is supposed to do it all. To help with trying to figure out who the other places are, Cancer Companions has a free download for you. It's our National Cancer Resource Guide. And so this free download ends up having over 500 different cancer agencies around the country that end up providing everything from financial services to transportation to food to all kinds of things, as well as it has specific categories for each of the different types of cancer, from breast to colon to pancreatic to prostate and on and on. And so this is a really valuable tool for you to be able to use and share too. So don't miss out on that. So if you go to our website, then you can end up checking out our Cancer Resource Guide. In closing, I just want to say that my belief is the best weapon against cancer is early detection. So schedule your cancer screening as soon as you can. Thank you so much for tuning in, and blessings on your day. Bye-bye now.